All right, and I think we have our last but not least presentation. This was our 2025 one of our safety fair winners, Miss Anisa Davis, presenting Reducing Hospital-Acquired C. diff Infections by Implementing a C. diff Stewardship Program.
Good afternoon, everyone. Happy Nurses Week. So we saw within the hospital, we had a lot of cases of hospital-acquired C. diff. What hospital-acquired C. diff is if the patient has been here for more than 72 hours, then the hospital owns it. If they were tested in less than 72 hours, it's community acquired, so it wouldn't be a negative effect on the hospital. So C. diff basically is loose, watery bowel movements in 3 or more in less than 24 hours. What we saw was that there was a prevalence of inappropriate C. diff testing, and so the C. diff infection rates were increased because we had a lot of false positives. So when we examined, we saw that pre-intervention, we examined for 3 quarters, and we had 20 cases of C. diff. And so that was 2.99 rate per 1,000 discharges. When we analyzed, we saw that the root causes of hospital-acquired C. diff were infection control practices, so hand hygiene, overuse of antibiotics, inappropriate testing, overuse of testing, and timing of collection on admission. So overuse of antibiotics is patients were getting a lot of antibiotics, so they kind of worked with that they have like a ID team that approves antibiotics. Inappropriate testing. So inappropriate testing is patients who are on laxatives, enteral feeds, and doctors are still ordering for C. diff. If you're on a laxative, it's expected that you're gonna have diarrhea, so it shouldn't be ordered. And overuse of testing, when patients were just reporting that, oh, I had diarrhea yesterday, I went to the bathroom 5 times, and there was no verification. So doctors would just order, and it was inappropriate. And we see that a lot of patients, because they know that they would get a private room because they would be on enteric precautions, let's be honest, and they want to be in their own room, they would say, I've had diarrhea, because they know that they're going to be tested for C. diff and they're going to be placed on isolation. And then timing of collection on admission. So we were seeing that sometimes orders that were being placed in the ED and then the patient is admitted up to the floor, the nurses might miss it because they didn't see those orders. So we just highlighted that the importance of collecting the specimen within 72 hours. So in March 2024, we formed a multidisciplinary C. diff stewardship team. It was established to address the elevated incidence of C. diff. The team is comprised of infection control, infectious disease, quality, clinical data analytics, IT, physicians, laboratory personnel, and nursing staff, which reflects a comprehensive approach to infection management. The C. diff stewardship team implemented the following interventions. So we did twice daily analysis of C. diff orders, a report that comes out in the morning and at 3 p.m. And so we analyze it to check the patients, check did they have laxatives, are they on enteral feeds, is the order appropriate, are they having loose, watery bowel movements more than 3 in 24 hours, speaking with the bedside nurses, hey, has your patient, because they're here for 12 hours, has your patient had any bowel movements? If so, can you collect? If not, can we talk to the doctor to discontinue the orders? The doctors discontinuing inappropriate orders and collaboration with nursing to collect within 72 hours on the appropriate orders. So during the change, we saw C. diff orders compared to the amount of inappropriate orders by month, and there are a lot of months where a lot of these orders were being canceled. Over 50% of orders were inappropriate. And the common reasons, again, enteral feeds, laxatives, the patient didn't have any bowel movements for more than 24 hours, and they also had duplicate ordering. So again, as I said, sometimes the ED physician would order it, and then sometimes the inpatient medicine physicians would also order, or somebody ordered it yesterday, they didn't see it collected, they order it again, but there are 2 active orders. We also implemented an IT intervention, which the physicians are supposed to review the criteria, the exclusion criteria. So it's, does the patient, as long as the patient does not have a chronic bowel disease, the patient has had 3 or more unformed stools in 24 hours, the patient is not on enteral tube feeding, and the patient is not on laxatives. So the physician, when they order, they have to check these boxes and attest that these criteria are met. And again, twice daily assessment of new orders, appropriateness, timeliness, cross-checking new orders with isolation lists supplied by infection control, because sometimes the list that is generated in the morning and at 3 p.m., there was an order in between and it was maybe collected in between, so they will not show up on the C. diff order list, but they will show up on the infection control isolation list. And nurse collection in less than 72 hours, so shout out to the bedside nurses, because they have been collecting more so now in less than 42 hours, less than an hour. The order's placed, they're collecting. Sometimes it shouldn't be, but again, we're working with nursing, we're working with physicians. It's still a work in progress, and the IT intervention that reviews the exclusion criteria prior to placing the order. So the change results pre and post data. Pre-intervention, we had 20 cases of C. diff, and post-intervention, we had 7 cases. So there was a 62.6% reduction, and there was a negative 65% rate of C. diff, pre-intervention, post-intervention. So the assets of this stewardship team is that collaboration with an interdisciplinary team. A lot of the times when nurses, speak to the residents might not want to cancel the order because that's what their attending wants. But working with the interdisciplinary team, the physicians on the team are able to speak to the attendings or even the nurses, and we've gotten them to review the criteria and acknowledge, like, hey, this order is inappropriate, and they have discontinued orders. We've communicated, it increases communication with the patient, nurse on duty, and medical team caring for the patient. So during IDR, this is addressed that, hey, you have these orders, my patient hasn't had a bowel movement, can we please discontinue? Daily C. diff pending collection list and daily isolation list. Again, these are the lists that we analyze every day to verify, are these patients being appropriately tested? Are we collecting in a timely fashion? And it also reduces, it's also cost saving because it reduces the amount of C. diff tests that we have to process. So again, another way that the hospital saves money and reduces isolation, which increases throughput. That's a major thing here, increasing throughput, getting the patients out of the ED. So that also helps with that by decreasing the amount of isolation rooms. The barriers are that the downtimes interfere with list distribution. So if there's an outage with the system, we don't get the list. Weekends, holidays, and vacations, no monitoring occurs. And it's time consuming because we do manual chart reviews, which is labor intensive. And sometimes physicians bypass the IT intervention for ordering. They attest that these things are not happening when they in fact are. And we've seen where we have gotten false positives because a patient was on laxatives. So this project highlighted the importance of a C. diff stewardship program, the importance of accurate orders, and the outcomes related to overall metrics, performance indicators, and reimbursement rates, because C. diff is like one of those measures that if you have a higher incidence within your facility compared to the surrounding hospitals, you don't get reimbursed. So future state for sustainability, we want to implement a verification stop on C. diff orders to have infectious disease review and approve before submission of orders. And a question came up that, what about during the off times? Who's going to verify these orders before it's sent through? And just like antibiotics, there's a process for approving restricted antibiotics during off times, and that's what we're looking forward to having. Any questions?
Excellent. Any questions? So proud of you. Great job. All right. I want everyone else in this room to know that you will be here next year. Everybody can do PI. Everybody can do research. So please reach out. We'd love to have you. Thank you so much to all the guests that came from the College of Nursing and from the hospital. So I just wanted to say, continue to lead with purpose and inspire growth, and I hope you have an amazing Nurses Week. We have some balloons and a poster over there if you guys want to take some pictures. And then just wanted to end today with just a quote that I found. It just says, to know even one life has breathed easier because you have lived. This is to have actually succeeded. And it's by Ralph Waldo Emerson. So just know that everything you do for our patients every day makes all the difference, and you are all so valued. Thank you for being here today.